Let's make this easy. But I have to tell you, it was very difficult for me too. When I first had to learn these, and I have to tell you, it was after my fellowship is when I really got serious about it, when I found out nobody really knew how to use the inhalers. So I would ask the reps as they come through, how do you use it? And I would look it up and all that. So you can do the same. You can absolutely learn how to use your inhaler. This is Pulmicort Flexhaler. I have a lot of videos out there showing this. And I know TikTok algorithm wants us to go. But this one is for the people who are not interested in all that, because I'm going to go very slow, just like I promised. There is a cap. When you get a Flexhaler, there's a cap. I have lost mine. This is almost 20 years old. Yes, it is. Don't look up my age, please. But anyways, so the cap is off, but you remember that if yours is on, it may be twisting off, and therefore you may be dispensing based on that. Mine is a teaching demonstration device. It's not going to have a counter, but yours will. And what I want you to do, if you're not sure if yours is working, is take it and go like this. See if you get any powder there. If you do get powder, it's working. If it's no powder, then you probably need to go back to that consultation section of where you picked up your inhaler and start asking those very beautiful, handsome pharmacists about what's going on, because maybe you have a defective device. So that's troubleshooting problem number one, because I don't want to teach you this and your device is not working. Number two is make sure that the counter, as you're saying, your counter is not moving. They move very slow, the old school ones, you know, they move slow. But what I want you to know is that if you use it, you want to take these three pieces here, the top part, and there's a midsection, and then there's a bottom part. What I want you to know is that I really want you to take it and this part, the second piece with the bottom piece. And I know it's confusing when I say forward, back, counterclockwise, clockwise, because you're actually twisting in two separate directions. So you look at me and you see I'm going one way forward, and it won't go there more than this. And then you're going to go take it back. Do you hear that? Yeah. Now you've actually dispensed. So now you will do the usual. Exhale everything. And then. Now, that is a whistle, because mine is a demonstration device. Like, I should have warned you guys that I will be doing the whistling. Yours is not gonna whistle, so I don't want you to get like, oh yeah, definitely mine is not whistling. That whistle means I took a deep breath. And I do need you to understand that that powder that you will see on yours has to be inhaled all the way deep. You can't do this. You have to go and you hold your breath at the end, okay? And also, I want you to put your tongue down. So this is sitting above your tongue, okay? Exhale everything out, empty always, because our lungs sometimes trap air and it's hard to fill something that's already full. So you need to empty first, always empty first. No shaking with these. Look at your counter, make sure that you have enough, because if it's 0, then it's done, right? But if it has 20, if it has 15, then it's gonna count backwards. And you should notice in 2 or 3 days that you've got numbers changing. Sometimes the counter is off. So if that's the case, you really need to take it back. But I'm just saying, you want to take your inhaler. This is the mouthpiece part, and you see that groove there? This is not what I'm talking about. You take the bottom, this part, with this part, and you hold it like this, or like this. And you go one way, which to me I say forward, but you see, this hand on top is twisting this way, while the bottom half is going this way. And then now we're going to twist back, or I guess clockwise for you guys. I don't know. But you're twisting in opposite direction. You heard that tick, the click? Exhale everything. Okay, and when you exhale, you don't have to go really, you just a slow exhale. Now, again, I'm Dr. Mkono. You have your doctor. You also have the pharmacist. You also have the internet. You also have the company that makes it will show you. There is also directions. There is Google. There's so many resources, but I want you to know that sometimes you're nervous, you're upset, you don't want to do this, you don't believe, there's so much anxiety when it comes to asthma and lung disease because it's a breathing problem, and I get it. So I want to let you know, though, that I had a very, very hard time with learning this one. I thought it was very difficult. I didn't understand if it's working either, so I can understand I can relate. So here we are. I'm going to do it one more time for you. And like I said, TikTok is not going to like it. I'm probably going to have like 0 views on this, but this is really for you. And for anybody else out there who is taking a Pulmicort Flexhaler or any of the inhalers that have this twisting motion, this is Asthma Next. It has the same, and now this one I have a cap, but it won't actually fit. And this was actually a real sample, so it has a counter. You see the counter right there? And you would do the same thing on this one. I hate to confuse you, but it's got a mouthpiece right over there, and you've got this one also has a little groove on top. You see that? So groove part A, part B, and part C. So you see how I'm going to twist? This one won't even go that way. So this one will go backwards actually. See, it's gonna go like this. It's gonna go like this. And then it's gonna go like that. So you're twisting in opposite directions and it won't go the other way. And then you don't wanna tip yours when you're gonna take it because obviously then you will dispense. You exhale everything out and then so whoever stayed to the end got the Asthma Next Twishaler. That one is a Twishaler. Okay, they are different names, but these devices, maybe you have from God knows where, and yours is called something else. But if they're shaped like this, this is how you use them. Now, if you're gonna put a cap on it, just remember, you may be twisting yours out as you take the cap off. I really recommend we cover these. So when you do cover them, if you don't want to be confused, just put it lightly, don't twist it. That way you're not twisting it when you actually open it. But usually once you open it, if I were you, I would take that first breath, or I will see if it's out just to make sure that it's working if you're trying to troubleshoot it. But I'm pretty sure somebody can help you if you take it in. Always remember to grab your inhalers, take it into your doctor, let them work with you. Yes, and it's okay if they don't know. They should look it up for you and they should send you somewhere to a resource so that you can figure it out. Now, most importantly, do we need to gargle? Yes, we do. This is where I'm going to talk to you guys again. This is memetazone. You see that? That's a zone. Yes, I just did a little video about telling you guys SONE versus NIDE. And I need you to remember that this is going to be the one that is your maintenance. Yes, it's not the one that's as needed. No, both of these. They just have a pure inhaled steroid inside if it's Pulmicort. Asthma Next, gargle, because that residue again can hit the back of your throat, especially if you do these really shallow breaths, which you shouldn't be. We need it to travel all the way down. You need to hold it and go, obviously we're gonna twist again one more time, one way, and then we're gonna twist another way. Do you hear that click? That means you did good. Exhale everything out. I am not gonna, make it like it's simple. I'm gonna tell you honestly, it was difficult for me. I hope that this helps. And I hope you realize that these maintenance medications, check with your prescriber. I am not giving you medical advice. I'm just teaching here, guys. I'm just teaching. Make sure you check the prescription. If they said 2 puffs twice a day, it's 2 puffs twice a day. And please don't forget to write in rinse, gargle, and spit out. Do it next to your toothbrush. Get your inhaler in first. Brush your teeth. Gargle with water. Water is enough. And that's it. I hope this helps. I really, really hope it helped. And I hope that you could share it with whoever needs it. And I hope I have advocated for you somehow in just telling you the resources that are out there that teach you, and do not give up on your asthma, because it doesn't give up on you. So it will cost you more if you do give up on it. If you truly have asthma, you need to take care of it. It's a chronic illness. There is no cure at the moment. You can be safe and you can reduce your admissions, hospitalization, flare-ups. That's still very nice, where you can actually live your life normally, like everybody does, without interruptions. The least, the better, right? I wish you all the best. Again, it's Dr. Mkono, and I hope you give me some sort of feedback that it did work. Take care.